Breast cancer is a very common situation in our clinics. Unfortunately, about 250,000 women will be diagnosed with breast cancer this year. Thankfully, most of them will be diagnosed at an early stage. The treatment has evolved a great deal. We are able to cure the vast majority of patients with early stage breast cancer with the use of surgeries usually included in the treatment algorithm. Some patients may or may not need radiation therapy, and some patients may or may not need a form of anti-estrogen therapy, usually a pill that's taken for 5 or 10 years. Nevertheless, we do have other types of breast cancer that present a little more advanced or maybe a little more aggressive, and that may require some form of additional systemic therapies like chemotherapy. Nowadays, we have immunotherapies and very targeted therapies for a subgroup of patients with what we call HER2 positive breast cancer. Thankfully, all these treatments have led to high cure rates. It depends on the biology and the presentation, what a patient may need to achieve that cure. But we work very closely with our surgeon colleagues, our radiation oncology colleagues, our geneticists to try to decipher the pathway for the best treatment for that particular patient. So treatment is very tailored to the patient specifics, but also the biology of the tumor, and these days also the genetics of the patient that may be acquired through a family history and or that may be just really related to the cancer biology. We have a comprehensive program here at Holy Cross where we have dedicated breast surgeons, we have a dedicated radiation oncologist, we have geneticists. Navigation is very important. We have a nurse navigator that helps patients through the journey of breast cancer. And we have dedicated breast medical oncologists as myself that focus their clinical and research efforts in management of patients with breast cancer.